Hello and welcome to The Well. I'm your host, Dr. Brendan Arm, Doctor of Acupuncture and Oriental Medicine, Chinese medicine herbalist, and founder director of Lotus Integrative Medicine in Santa Monica, California. There's a wealth of health-related information out there, and I'm joined today by this wonderful group of integrative and holistic medical doctors and practitioners to share some of our favorite wellness tips. Please let me introduce you to Dr. Heath McAllister, a naturopathic doctor and registered herbalist; Leona West, a clinical nutritionist and herbalist, also trained and certified in functional medicine; and Dr. Rob Krochmal, a medical doctor and a practicing physician who is board certified in family medicine, nutrition, and integrative and holistic medicine. So let's begin. Today's topic is holistic assessment. I guess I'll just hop in right here because each of us probably has a little bit different assessment when we meet somebody for the first time. My training is probably about half it's just straight Western allopathic, and the other half is a combination of, herbalism and acupuncture and, nutritional and lifestyle recommendations. So when I meet with someone for the first time, there's a bunch of paperwork, which is sometimes a little overwhelming, but it's really, really helpful because then it actually shows that I want to know the whole story about somebody because this is a holistic modality. And when I meet with them, it tends to be a little longer, about an hour and a half for the first visit. And we go over the history, we do an evaluation, we do an exam. And part of that exam is looking at something called tongue and pulse diagnosis. And that's probably the thing I'll just share a moment about, and then I'll kind of let everybody else kind of chime in. That, all this is in preparation of coming up with what we call a Chinese medicine diagnosis. And then from that, we put together a treatment strategy, which typically includes the acupuncture points, the herbal medicines, and any other, type of instructions or recommendations. But the tongue and pulse diagnosis is kind of interesting. I'm not looking at people's pulse in terms of, the pulse rate exclusively, although that is part of what's factored in, but what the pulse feels like. So, is the pulse, and sometimes I share with patients, like imagine a river or a body of water. It can be very wide or it can be very narrow. Either way, it can be very forceful or weak. So it's not necessarily, when I'm feeling the pulse, it could feel very thready, or it could feel very weak, or it could feel very deep, or it could feel very fast, or it could all different things. And that all plays into, what is unique about this individual and any imbalance they have. Same thing with the tongue. We're not just looking at the tongue color, but we may be looking at the body shape. So the colors can be changing from pale to red to purplish, all kinds of things. But the body shape itself may be swollen or flabby or teeth marks or, cracks or all kinds of things like this. And even coating itself, the coating could be very thick or greasy, and all this influences, the diagnostics. That's what I have to say.
I would say for a lot of the work that I do, so much of how I'm assessing a patient really just comes from their mouth. I mean, they're literally telling me a story, and I'm asking some follow-up questions here and there, but I'm really letting them describe their issue, and I'm giving them that space to tell me their story and tell me how they're suffering or how they need my help, and then I'll ask follow-up questions, and oftentimes just from that history alone, it already has pointed me down a certain avenue of thought. And then most often I follow up with doing certain specialized lab testing, and I do a lot of digestive lab testing and a lot of nutrient lab testing, and, also standard things like thyroid and blood counts and things like that. But like, I find that those two are really invaluable pieces of information. Their story that helps guide the objective assessment that I'm doing on them. And right now I'm mostly doing remote consultations with patients, but the third leg of the stool would be, I do a lot of physical assessment when I'm able to, and that can involve, actually just feeling certain areas, like seeing is the liver swollen, are there lymph nodes present, are there things like that, which also are indicating, is there infection, is there congestion? And I do a type of muscle testing assessment on some patients as well, which is also looking deeper into the organ systems from an energetic standpoint. So, but initially the history is the main thing. If I only had one thing to go off of, I would go off the patient's history. Everything else kind of follows below that. And I think, you mentioned tongue and pulse, Brendan. I was trained in tongue and pulse also. Interestingly enough, for me, the pulse represents the autonomic nervous system, is what is like the nervous system's overlay on the physiology at that moment in time. Interestingly enough, other traditions also look at pulse. I was trained in traditional Mayan healing, and they also recognize like 18 different pulse patterns that someone can be into. So again, that to me, that's a traditional way. That's your primitive ultrasound. That is your primitive lab testing. That's the ways that primitive people, before they had these, science with a capital S, how they were able to understand and group, human conditions. So I just think it's interesting how universal truths kind of get unlocked by different cultures.
Yeah, I would say I would second that. No, the labs, which we'll get into in another episode, which are incredibly fascinating and can, of course, give a lot of information, are really just numbers on a piece of paper. But I second your idea about taking the history, creating that space. I'm really conscious of creating a comfortable space for people to be in and really listening. And a lot of times, someone just being able to tell their story, they're figuring stuff out as they're talking without you even saying anything. Sitting back, and sometimes just some amazing gems come from that are completely surprising and can lead down a path that neither of us expected. And so that's what I love about my first assessment, is just really getting to know someone, really having it be their agenda and not my agenda. And of course, being conscious of doing my due diligence and in my job, and finding out what may be happening that they need to know. But really, in terms of personalizing, if it's their agenda and I know them and their life, then I'm going to be a much better doctor that way.
Yeah, I think this is unanimous, but I think this is the hallmark of integrative, holistic, functional approaches. Is truly, that's our primary place that we lead from, is letting the patient or client lead and getting their whole story. This is like a huge tenet in functional medicine, is getting that full timeline, getting that story. And then, yes, being able to get a feel for them, definitely tongue, nail, eyes, skin. There's so much nutritionally that you can gauge just by looking at those elements of the physical body. And then combining it with that objective testing. But we can't, you're so right. The objective testing doesn't mean much without all of that time we spent initially getting that story, getting that history. And if we listen long enough, the patient, the client will basically tell us exactly what's going on, and maybe kind of unlock those elements that maybe we're not even, kind of giving that space to bring it all to the surface. And that's what they're not getting usually, not always, but usually in a totally allopathic setting.
Well said. Well, that's all the time we have today. There's a lot more to talk about on this one. We'll have to have subsequent episodes about that. But if you have a topic you'd like to learn more about, let us know with a comment on social media. And also don't forget to subscribe to our The Well YouTube channel. Thank you for joining us, and please join us next time for more wellness tips. Remember, regardless of where we are, our resources in the well are limitless.